So I know we've given you all a lot of information. I'm going to go very quickly because we're a little over on time, but this is really just to give you some guidance. And it's, by the way, it's great to see so many of you out there that I already know. Next slide. So here, I'm going to go over some keys to building the successful initiative. First thing you want to do right now is look at who is on your team. You need to have your key frontline on the team. You need to have interdisciplinary team members. The C-suite support is so important that you have that leadership support and that everyone's engaged and they are committed to this initiative. Next slide. Who should be on the team? I've already said it, bedside nurses, frontline OBs, different physicians, the advanced practice nurse, if you have a CNS, CNM, nurse managers, directors, you can read all those people, social work, case management. The one person, a couple people sometimes forget is that informatics expert, that could be a nurse expert or somebody from the IT team, also a pharmacist with this initiative, the emergency department. And of course, family reps. If you can get one on your team, that is amazing. Next slide. The next thing we want to talk about is culture ready for change? So again, what you want to look at your own organization, make sure that you have a safe environment for people to come together, share what some of their concerns are, share some of their best practices, this deeply listening to them, respecting each other's opinions and really helping each other out. We have a beautiful toolkit for you to use. You want to get your team engaged with the why as soon as possible. Next slide. And really telling patient stories. There's a great one that we shared at the initiative kickoff. We won't share it today, but that's a great way to get people involved, is connect it back to the patient. With your team meetings, you want those to be organized. You may need to meet bi-weekly initially or monthly, depending upon how much work you have left to do, including all your departments that are affected, again, in that family rep. Have your agenda ready to go. One of your first meetings, you might want to look at your data, look at developing some type of 30, 60, 90-day plan. Look at what small tests have changed. Something easy, doesn't take a lot of work, low-hanging fruit. That's a great PDSA cycle to start with. And you're going to be ready to go with your coaching call. So try to get 1 or 2 people on each coaching call. Next slide. Keep your admin team also obviously in the loop. You can present at OB division, different admin meetings. So one of the things we provide for you is a quick start checklist, and that is on the next slide. That's a hard copy we will give you. And basically on the next slide, kind of goes through, oh, we didn't even include it this time. That's okay. You have a hard copy of that and it's in our toolkit. Basically tells you where to start to get this initiative going. The key driver diagram, I have that printed by my desk so I can keep it front and center. And I would suggest that as you have meetings, always have that key driver diagram. It helps keep the people focused. And you've already seen the entire key driver diagram today. Next slide. You also want to go through your 30, 60, 90-day plan. Maybe start with, what am I going to do in 30 days? Okay, let's evaluate some of our policies. You may not be able to upgrade all of them to a nurse-driven protocol within 30 days, but maybe 60, 90 could be a long-term goal, because that would obviously have to go through med exec and that kind of thing. So 30, 60, 90-day plans, so the team knows the direction they're going. What are you going to accomplish? The next, going through some PDSA cycles on the next slide. Oh, this is a nice example of 30, 60, 90, and we already talked about it. So next slide, PDSA cycles. This is so important. As a nurse for many years in the hospital, we used to call them trials. We're going to test something. So this is very exciting. You guys do it all the time. You just don't realize it. But with PDSAs, what you want to do is take one small test of change, maybe a different colored piece of paper for a report, or maybe it's just something you try it with one patient, one nurse. Try it, see how it goes, and then revise. So you want to continue that cycle and looking at your data along the way to see how you're improving. Some people call this PDCA, Plan, Do, Check, Act, but this all comes from IHI. Next slide. It's really exciting because on coaching calls, what we want you to do is just present one PDSA cycle per quarter. It's very easy. We give you a nice template that has the PDSA Plan, Do, Study, Act, and we can talk you through that if you need help. Next slide. So of course you're thinking, oh my goodness, I've got some barriers going on. So one is time. So if you can just make sure that you plan your meetings far out, that's 30 days, just go ahead and take your calendar and plan these meetings out, make sure people know, make sure you got the right people around the table. You can even have some virtual. We do a lot of Zooming. So maybe your staff nurse that works night shift can't come in, but maybe she can Zoom in. And also you want to highlight your results at your OB division meeting or whatever leadership meetings you have. Next slide. As the project continues, celebrate. They all know me at FPQC, I love to have parties. So I always want to celebrate whatever success we have along the way. The other thing, keep that data front and center. When I do my clinicals at different hospitals, it's so exciting when I walk on the unit, I can see the FPQC, that their dashboard's up and everybody's displaying the data, which is awesome. People love to see that. Make it stick. Plan for sustainability as we move along. You're going to think about how can we keep this process going to sustain, keeping that focus on the drivers. So next slide. So October to December 2024, here we are, November, almost the end of November, goodness. So first thing is to assess, look at your team, who's going to be on your team, make sure you got all your critical departments, review those prompt resources. The toolkit is available for you now, and we are adding to that. That toolbox will have more and more things. We're getting ready to, I just put in there to get the Sarasota Memorial Hospital nurse-driven protocol into our toolbox. So you have access to that. Any updates as we go along, we add more and more to the toolbox. Hopefully we already had the data collection webinar, so I'm sure you guys are making up with that with the data team. And then just start planning now for your January launch, because you will be wanting to, our coaching calls will start in January. So you want to get that team, make it exciting, have a party, start planning now. It's the end of November, but for January launch. So next slide. January 2025 official launch. Be sure to, you'll be hearing about your coaching calls to come. We have not sent those appointments out yet. We are finalizing our coach mentors in each of the 10 hospital groupings. Just be sure to get your team engaged and keep them engaged. And your structure measures, I believe, are due in December, and the data team can tell you about that. And once we get our coach mentors sent out, you can, that first quarter, you can plan to have a one-on-one session. They're happy to do that, a one-on-one mentoring session with them. So next slide. We have all sorts of resources for you here in the toolbox. We talked about the coaching calls, technical assistance. What I will tell you is at the kickoff, I did play a video that was from the March of Dimes, and I'll have that in the toolbox as well, because one of your first meetings, what you want to do is really show something. You can choose whatever video it is, but something to get your team really engaged on this project with the why behind it all, because we would love to have Mandy there, but she obviously can't go everywhere. So it's really nice to hear from a patient story of something around preeclampsia. And then you're going to be getting your data. You're going to get monthly, quarterly QI data reports. We do email bulletins. You can read everything that we do here. We are also available to do consultations, so just reach out to FPQC. Next slide. I want to touch just okay, so that was how to get things going, and I did that in less than 10 minutes, so I know I zipped through it, but I wanted to leave just a couple minutes here for the simulation that we did at the kickoff. Just to touch on this a little bit, I'm sure you all are doing simulation, but we do know that it's very important that it's hardwired into your practice. Joint Commission looks for this, DMV looks for this. The reason why is because we know it improves patient outcomes. There's evidence to support this, that people can practice these clinical skills in a safe environment. The things we're looking for with your simulation drills is that you have teamwork, you have closed loop communication, you have role, so everybody knows role clarification when they walk in the room, what their role is. Really helps with that teamwork, building that. Also incorporating a respectful maternity care. We have a great A1 debrief tool that also asks those questions about respectful maternity care that is also, will also be in our toolbox for you. Next slide. So just on the next slide, I thought it would be important to tell you where it comes from. You probably already know this, but the Joint Commission Provision of Care chapter does talk about two elements of performance. One is EP3 is role-specific education. You all know this. You have evidence that your people attend some type of training. It can be in your health stream, however that is. But important here is that they're looking for ED education. Regardless if you do OB or not, your hospital has to provide OB to the OB people in the emergency department. And this free contact hour we gave you the link to, that is one way to meet that 1 hour contact hour for education. On the next slide is where the drills come in. So now you have this knowledge, but we want to see simulation. So most people do this, like some people do it quarterly, some people do it monthly. It just depends upon what your needs are with your hospital. But at least annually, you should do something around hypertension, an in situ drill, so people can see in your system how things run. Do you have any people issues, process issues, equipment issues, areas of opportunity? And very important in all of this is doing a nice debrief. And so we give you a beautiful tool from A1 that is not copyrighted. They like people to share, use this. We use it in our A1 OPS course, but it is available. It's open for everyone to use. Next slide. And so we did the simulation. We did a really lovely debrief. Basically, with your debrief, what I want to tell you is you can all be trained to do a debrief. It does not require to be a clinical nurse specialist or a nurse manager or director. You can do a team debrief, lead a team debrief, because it's important that debriefs are done timely. So that was what we emphasized at our kickoff was, if you have a severe maternal event, we want to see the debrief. Hopefully you'll use the A1 tool or one that you have at your hospital to look at what were our strengths, what were our opportunities, and where's the follow-up that we need so that this doesn't happen again. And it's completely different than an RCA or a comprehensive peer review. It's the team coming together, do a quick debrief, what went well and what could we improve upon. Next slide. And so again, I've already gone over this. I won't say it again, but you can read it. But again, it's really, it's a very nice way. People oftentimes want to talk about what happened. And yes, it can be hard to pull everyone together, but if you're organized about it and you keep them very succinct, you can do a very nice debrief in like 5 to 8 minutes and get it done. Next slide. And I think that's it. So the initiative website is there for y'all to refer to. And now we're only 9 minutes over for questions.